Tonight at 8 p.m., a special primetime edition of News 3 puts the spotlight on childhood obesity.
1 in 3 children in this country is currently overweight or obese. It is an epidemic with severe consequences. Dr. Zorba Paster joins us to talk about this from his clinic in Oregon. Hi, Zorba. Nice to see you.
Hi. Pleasure to be there.
How can you tell if your child is overweight or obese?
Well, I think a very good idea is to talk to your healthcare provider, your doctor, nurse practitioner, physician assistant. The reason is BMI, which is a measurement of height over weight, is different for children, and frankly, all children are not the same. So the measurement we'll say for a child who's 5 or 6 is different than for a measurement for a child who is 8 or 9. So it's very important not to just make that decision yourself. Because, for instance, as you know, little babies, little infants can look like they're overweight when in fact they're at a normal weight. So I think talking to your physician is one thing. Now, at the extremes, if you will, we know whether or not our child is overweight. But if we're in that questionable area, ask a professional and they'll give you part of that answer.
You know, you see these BMI calculators on the internet and things, and you plug in numbers. They're for adults. Do they work for children as well?
They do not work for children. In fact, you don't want to use them for children because at the age of 5 or the age of 10 or the age of 12, they're going to be completely different. So they're age specific and they're also sex specific. They're different for growing up, for boys who are growing up, and different for girls who are growing up too. And I think that's part of an important aspect when we look at obesity. We've got to define it, and then of course we've got to take action on it.
How severe are the consequences of not reversing this trend?
Oh, the consequences, according to the CDC, are very, very much worse than we ever thought would happen. I'll give you a very good example. I had a child who came in here about 1.5 years ago, a child who was clearly overweight. She was 12 years of age and she weighed 300 pounds. I don't need a chart for that. I knew obviously she was overweight. She had a blood sugar of 350 and she was what we used to call an adult onset diabetic, and she was only a teenager. And when I looked at her mother, who weighed about 200-300 pounds, and I looked at her sister, who was also there, who was overweight, I realized this was a family situation. And I think that's very important. People don't realize what they're eating and don't realize the obesity epidemic because they're often overweight too, and they're not mentoring their children correctly.
So what can you do with a 12-year-old girl that weighs 300 pounds? And where do you even start?
Well, you start as a parent. That's what you do. You start by taking an action. I think a very important way to start is with home-cooked meals. I think if we look at a lot of our overweight, it's from prepared foods that are filled with salt, filled with sugar, filled with fat. Many people have lost the ability to actually prepare food at home. So I think food is very important to prepare. Pulling the plug out of all electronics and spending some time doing some exercise with your kids, mentoring being very important. And then there's new research that shows if you don't get enough sleep, you tend to be overweight. So making sure that your child gets 8 to 9 hours of sleep may be important to make sure that they're not overweight. And as you can imagine, there are lots of little things that you can do too that are hard to go in just a short conversation.
Well, in our special tonight, we talked about a study in the New England Journal of Medicine that said this generation may be the first that will have a shorter life expectancy.
Right.
And parents and grandparents, that is a serious wake-up call.
That is a serious thing. Heart disease, diabetes, and other things. And like you said, where do we start? We start by mentoring our children and taking action. An incremental short step is better than no step at all.
All right, Dr. Zorba Paster, great advice as always. Thank you for your time.
A pleasure.